Hello, Facebook. What's up, Elevate Holistics? We're live. I'm Russell, and we're starting up our AMA segments again, so I'm super excited. We got a good one tonight. We're going to be on with B Health Consulting founder, Kelsey Schwander. And as soon as I see some people pop in, we're going to start this up. But this is going to be a really good AMA, informative about the true science of how cannabis works in the body. And let me check when she gets in here. How cannabis works in the body and how it relates over to healing you naturally. What's up, Dane? So we got some folks in here. Thank you everyone for coming out. Be sure to like and share this video as we get Kelsey in. Be sure, this is gonna be real life knowledge about cannabis and how it helps you heal. So make sure you share this with all your friends and family. And especially anyone, like I was saying, Kelsey's a doctor of pharmacy, so anyone on medications, you want to be educated on these drug interactions and truly how it works to heal you. This is going to be a good one. And then just comment in as y'all get in. Here she comes. I'm going to bring Kelsey on now, and I'll give her a moment to introduce herself, everyone.
All right, look at us.
All right, we got it figured out.
Yes, thank you so much for joining me tonight, Kelsey.
Yes, thanks for having me.
We got some folks in now. Yeah, absolutely. No, this is a pleasure. I was just kind of giving an introduction of what we're going to be talking about tonight and who you are. So without further ado, if you want to say hello to folks, I was thinking let's just start this off with, a little bit about you and how a pharmacist got into cannabis.
So hi everyone. My name is Dr. Kelsey Schwander. So I am a doctor of pharmacy or pharmacist. So I'll tell you kind of a little of my background and how I got involved in all of this. So I'm originally from Denver, Colorado, and I moved to St. Louis about 3 years ago. And so currently what I'm doing is I work in a doctor's office. So I'm more on the clinical side of pharmacy. And sorry about that. And so, and then I also am a professor at a local pharmacy school. And so about 1.5 years ago, can you hear me okay?
Yep, I can hear you perfectly.
Okay.
Yes. Can everyone else hear us? I see folks are watching, so I believe everyone can hear you well.
Okay, awesome. Half a company, Be Health Consulting. And so I meet with patients one-on-one and I go over all of their medications so they understand it better and supplements. And about 1 year ago, I really got into cannabis education. So being from Denver, recreational cannabis happened, when I was in pharmacy school. So it became second nature to me to ask my patients, do you use alcohol? Do you smoke tobacco? Do you use cannabis? Because there's drug interactions that are really important. There's disease states that are really important, and we may dose things differently based on it. And so I just have had a lot of experience now working with patients in cannabis. And so when I moved to St. Louis, I noticed that there was a huge gap in knowledge, especially from healthcare providers. So that's when I started educating healthcare providers. So I did webinars and I've done continuing education courses for, MDs, NPs, psychologists, counselors. And, now I'm really getting in front of patients. And I have some exciting collaborations with some dispensaries coming up. And so just a lot of fun stuff coming up. And, if you want to find out more, you can always go to my website. I'm sure it'll be, on the post somewhere. This is me and my, and the comments are somewhere, Be Health Consulting, to find out more details. And you can find out more of what I do there.
Yeah, no, that's wonderful. And thank you. That's why I want to give you the chance to shout that out. And I've got a good little line of questions up for tonight because, as you said, you really educated, and that's what we found. Besides doctors who have really delved into it and they go in their own personal time to read, this isn't something that's normally taught. And you were kind of there right on the forefront in Colorado, where I can imagine it was pretty important. You had to ask people, are you on cannabis? Because there's just a regularity, huh?
Yeah, exactly. And I think what a lot of people, and I didn't realize at the time, so I went to Colorado University for my pharmacy school, and we had classes on it, which I think to date in the United States, less than 11% of medical schools are teaching on cannabis. And I was in pharmacy school a while ago, so we were kind of ahead of the game. And then again, I've done a lot of my own education. So I have my clinical cannabinoid certification. And, you have to do more research because there's not a lot of research out there. So yeah, so definitely had to do some digging.
Absolutely. And I guess at the end of this, I would love to hear what resources you have for folks to look into in your digging, what
Absolutely.
might be reliable sources. But to start off, can you tell us what is cannabis and really like CBD and THC? What are they in cannabinoids? Let's start there.
Yes. Yeah. So it's funny when I do talks, I always start, what is cannabis? Or when I meet patients, a lot of the times they're like, what is this cannabis? What is it actually? What are we referring to? It's kind of this newer term, it seems like. And so for some of the audience, this may be a review for you, but it's always a good one. So I always explain it as like cannabis is kind of an umbrella term. It involves CBD, THC, where I feel like marijuana used to be the word. And I was actually listening to a podcast last week, and someone used the word marijuana, and the physician on there was like, oh, no, we don't use that word anymore because it has like a bad connotation, which I thought was interesting and kind of funny. So cannabis is, the new word, the new sexy term. But I would say, so when we are actually talking about cannabis, is referring to the plant, the flowering plant. And we know that the plant has, over 400 compounds in it. And we're still discovering, what they do in the body. And so the ones that we are most familiar with, and especially from a medical standpoint, is the cannabinoids. So the cannabinoids, so the two biggest ones that everyone, talks about are THC and CBD. So, THC is the tetrahydrocannabinol. And so it's responsible for the psychoactive side effects, or the high feeling, and we can get into that later. And then CBD, which is the cannabidiol, which, because of the farm bill, you can get CBD, at the grocery store, at the gas station, everywhere now. But those are kind of like the big points of the different types of cannabinoids. And like I said, CBD and THC is really what we'll focus on because we have more evidence in how it can help medically.
Right, absolutely. And I was going to add to that is it is interesting how we learn more, and the more we know about it, how terpenes play a part, and everything really comes to the connection of all of these different chemicals and cannabinoids together in a nice ratio. So let's step that into the next topic. And can you tell us how does THC and CBD work in the body? Explain kind of the receptors, how this is transported, and I think that's going to touch right into the endocannabinoid system.
Yep, so exactly. So we have the endocannabinoid system in our body. So when I first introduce this to people, I always tell patients and providers and businesses, think about it like any other system in our body. So like the nervous system, the cardiovascular system, it's another system. A lot of providers say like, hey, Dr. Schwander, why haven't we heard about this before? And the reason being is, it was discovered in 1992, which isn't that long ago. We've known about, the nervous system and other systems in our body for a really long time. And so we're still just discovering a lot about it. So it's just a biological system. We have neurotransmitters, so endocannabinoids that bind to two main receptors that we'll talk about. So there's the CB1 receptor, and then there's the CB2 receptor. So the CB1 receptor is mostly found in our brain, our like spinal cord, and THC binds to CB1 receptors. So if you think about how the side effects or what THC does, and think about where the receptors are located, it makes sense. So it helps with pain, the psychoactive effects, so the high feeling, because a lot of receptors are in our brain. So CBD binds to the CB2 receptors. So CB2 receptors are located on a lot of our immune cells. So that's why we're finding that CBD is really good for anti-inflammatory effects and things like that. So those are kind of the two main areas, if we want to break it down. And the endocannabinoid system is really responsible for like homeostasis in our body, a balance in our body. And so when something's off, like any disease state, we have things that we want to put it back into balance. And so that's how we've kind of found that THC and CBD is helping put it back in balance.
Yeah, that's amazing. And I'm just going to pop over because I see comments are coming through. So good information. Can you see these at the bottom or no? because you don't have to pay attention.
Okay.
They're kind of tiny, so
If you could read them to me.
Yeah, absolutely. I'm just gonna catch a couple. There was one that a viewer asked, please remember it's not about getting high, it's about saving lives. And that's so true. And as we talk about the balance, I think it's a perfect time that just caught my eye. As you're speaking about balance and the different areas of the body where the endocannabinoid system lies, can you relate that into I would think like different diseases that might affect different parts of the body, and kind of tell us a little bit of how traditional pharmaceuticals work and why cannabis seems to be a better alternative because of what you just described there with the CB1 and CB2 receptors being spread at different parts of the body?
Yeah, so shout out to whoever wrote the comment. I completely agree. I would say, there are some patients who do want to have the high effect, but I would say 98% of my patients don't want to be high. They really are looking for the medical benefit. So we're really, finding some great benefit for our patients, better than prescription medication. So kind of like I was saying before, so CB1 receptors are in our central nervous system, they're in our spleen, they're in our heart, they're in our GI tract. CB2 receptors are mainly on our immune cells, like I was saying, so macrophages, T cells, B cells. I may be digging too far in the woods. So there's a lot of different disease states. I mean, I just listed almost like every body system pretty much. And that's why if something is off balance, we find that cannabis can put it back into balance. Now, one thing that's different between like prescription medication and cannabis is that prescription medication really targets one receptor or one area, and it can have different side effects that we don't want. With cannabis, we call it you may have heard like the entourage effect. So the THC, the CBD, the terpenes, and terpenes are the kind of the oils of the plant, in case people don't know what that is. They work together synergistically and help all different kinds of areas of the body positively, and they don't go after just one receptor like some prescription medications. With that said, I will say prescription medications, as a pharmacist, I have seen prescription medications save lives. I think they're really important when needed, but I also realize that in certain disease states, it's with certain medications, if cannabis can be used instead or to supplement someone's medication, like opioids, for example, for pain. If I have a patient who has chronic pain and is on high amounts of opioids, if they use some cannabis to decrease that dose, I mean, I'm happy for that. I prefer them to do that. So hopefully that kind of answers your question.
Yeah, no, definitely. This is right on track of everything I think is so important for people to know about, how cannabis works in the body, which I was just, every time I'm glancing over, I'm checking out my questions and the question deck.
Fine.
And we're getting good responses. Everyone's really enjoying the information, and thank you so much for this, because it is just great to have someone like yourself who really understands how pharmaceuticals work, how cannabis is working, and you can break it all down for us. So speaking about disease types and that, I wanted to ask, because you mentioned patients on opioids, and it seems to be like what we have for pain. Are there interactions between cannabis and medications? And then I kind of want to drag that into the second question I have here is, can cannabis interact, or is it harmful, or should it be avoided with specific diseases? Is that clear?
Yes, cool. That makes sense. So let's start with the medication. So yes, cannabis can interact with supplements, with prescription medications. I have a lot of patients who, say, oh, well, cannabis is completely natural. Like it can't interact with my, my prescription medication. I'm like, no, it can. So we have to be careful. There's like 4 main interactions I like to talk to people about. So I'll kind of briefly go over those. So hopefully that will give people an idea. I won't go over all the medications because there's a lot on how they work, and it depends what other medications you're on, but I'll go over generally how these interactions work, because I think it's really important for you to understand, because a lot of healthcare providers will be like, oh, it interacts, like you can't use it. That's not necessarily true. You really just need to talk to someone, who's aware of the interaction. So what happens is when you have a prescription medication and you have cannabis, what happens is when you consume both of them, they have to be metabolized, and a lot of times they're metabolized in the liver by like the same enzyme. And so what happens is when they're both in there, they're kind of fighting to be metabolized, and one wins out. And so what can happen is whoever loses that, so let's say we have a prescription medication and then we have THC. So we metabolize them, and this prescription medication wins and they hold on to the enzyme, and so THC it increases in your body. So there are some prescription medications that will actually increase the amount of THC or cannabis or CBD in your body. So you want to be aware of that because you may need to consume less than another person would. So that's kind of one example. Another example, which as a pharmacist, this is more scary for me, is when it's the opposite. So when we have a prescription medication and THC, and the prescription medication levels change. So if the prescription medication goes really high or really low. So for example, let's say it's a blood thinner and there's an interaction and it increases. So you're at an increased risk of bleeding. So that can be really dangerous. So we need to be aware of that. Some other interactions that happen are additive effects. So THC, alcohol, benzodiazepines, so like Xanax, things like that. They have additive effects. So like sedation, for example. We know that THC can have sedating side effects, but you add alcohol and you add some medications that can increase that, it can be dangerous as well. So that's kind of like the third one. And then the last one is some medication, prescription medication. We call them prodrugs. So this is really nerdy, but I think it's important to know.
It's so interesting, absolutely.
So one example is a breast cancer drug. It's called tamoxifen. I don't know if anyone's heard of it, but it's a prodrug. So what that means is when I consume it, it's not in its active form. It has to be metabolized to get into its active form. And so what happens is if there's an interaction, so let's say I take that medication and I take cannabis and there's an interaction, that drug can't be converted into its active form, and therefore it's not working. And in this case, it's a cancer drug. So, that can have really bad side effects. So there's drug interactions. It can happen. Sometimes we can monitor it. So it's really important to let people know what you're on, a physician know, or someone like myself know, so we can help monitor that. Not to go too far into the medications, but the big ones I like to let people know is, so blood thinners, you want to be careful, talk to someone about it. Any HIV or transplant, if you have a transplant medication, we have to be careful. And then any antipsychotics. So if someone has, some mental health issues and they're stable on their antipsychotics, we want to be careful, because if they interact, we can, disrupt that balance. So those are the four, generally speaking, we really should be careful of. So.
Yeah, absolutely. It sounds quite important what could happen and the potentials. And as you're explaining, there's only so much processing the body can do. And then the effects of the left out substance can have negative effects. So let's step that into, that's very interesting. I think so important for people to know. And that's why a big thing for us at Elevate Holistics is doing, AMAs like this, and then supporting pharmacists like yourself and putting you all in touch, because there are a lot of patients out there that have no idea. And it's kind of that thought, as you said earlier, what's cannabis? It can't hurt anything. It's just going to be better for everything.
Yeah.
So speaking about that, and as we mentioned, there are drug interactions, there are concerns you should be aware of. What are, if any, are there dangerous effects to cannabis? And are there any downsides to cannabis as a medicine?
Yeah. So, and sorry, let me go back real quick about the drug effects, because I left one thing out. So someone mentioned opioids. So there is a drug interaction there, but it's actually a good drug interaction. So it actually, the patients who use both of them together, we find that patients can use less opioids. So that's something that you have to be careful because of the sedative effects, but some drug interactions can have good responses. So keep that in mind too. So sorry. So your question was, are there dangerous side effects of?
Yeah, we can go into that. Actually, since you went back on that, we'll go right back in the dangerous side effects. I do want to ask, because I heard one time that ultimately for chronic pain, and what you just said about, opioids as a solution for chronic pain, that they're actually a dead end street, because chronic pain differs from what an opioid is designed to do. Can you
Yeah.
explain that and why cannabis is better for chronic pain versus opioids and why that is?
Yeah. So opioids, the way they work, they bind to your mu receptor. I won't get into too nerdy, but
Yeah.
what it does is it kind of blocks the feeling of pain. So it's kind of like a Band-Aid. So instead of fixing the problem, it's a Band-Aid. And we know that opioids, people can overdose on them. So because there's receptors in the brain and we can overdose on them. We know that opioids can cause your lifespan to shorten for long-term use. Causes constipation. It causes all these problems. And so we know that, so cannabis, the CB1 receptors are almost absent in like your respiratory area in your brain. And that is why there's never been any recorded overdoses of cannabis ever. So the fear with opioids is called respiratory depression. So you take too much, and a lot of people do it on accident. They don't, they forgot they took a dose, or, they don't realize they took two at one time or something. It happens all the time, and they stop breathing. And that's what happens in an overdose, where cannabis, you can't overdose on it. You may not feel great if you take too much, but you can't overdose on it. So the side effects, with cannabis compared to some prescription medications are, there's not a lot. Sedation, confusion, with some, if you don't, aren't dosing it correctly, can happen. But again, that's a lot better than, respiratory depression compared to some of our other medications.
Yeah, absolutely. And I think that led right back around to the safety and are there downsides, is dangerous side effects. And you mentioned there's never been a recorded overdose, and it's almost designed to stop. And as we covered those past two topics, I think that's what is so important about the education, because I think the biggest danger with cannabis would be its drug interactions with other medications. Do you think so?
Yeah, I agree. And I think
a big concern.
Yeah, and I always tell patients, if you're on opioids or chronic pain, you always, no matter what you're on, you should always tell your healthcare provider that you're starting to use cannabis, because they're going to have to monitor you. They're changing the dose. With opioids, we know that it can increase sedation with cannabis. So that's kind of the bad side effect we need to be careful of. So always talk to your provider before you start cannabis if you're on opioids. But again, the downside to the side effects of cannabis are minimal compared to some of the prescription medications out there.
Yeah, no, absolutely. And that's why I think it's so incredible. Thank you again for coming on tonight and sharing this knowledge and information. To wrap down, that's really all I have. Are there any final thoughts that you would like to touch back on, or you feel just important with what you've learned being in the cannabis industry, with your knowledge and experience, that anything you want to touch back on you think is important for patients to know?
Yeah, I think patients, don't be afraid to talk to healthcare providers about it. Your healthcare provider may not be an expert in it, but if they are a good healthcare provider, they'll at least take note of it. They're aware of it, and they may help find resources for you. Because if we don't know you're on it, we can't really help you. You could be hurting yourself, with other medications, or it could, your lab values may be off or something that we need to be careful of. I will say one thing a lot of people don't realize, especially with CBD, is that it's metabolized in your liver. So patients with like severe liver dysfunction, just because you can buy it, anywhere, I always, ask patients like, do you know is your liver function good? Because CBD is metabolized heavily in the liver. So just be careful of that, because you can't go out and buy it anywhere. But again, a lot of people don't know the doses and interactions, and it's okay. So don't feel like there's, you know, silly questions, because they're not. I have providers ask me all the time, like, you know, what is CBD again? Like, can I take it with
Right.
this? Like, you
And
know,
these are
and
actual doctors, huh?
these are medical doctors, and they,
Yeah.
you know, in the clinic I work in, I give a presentation to all of my docs, and you know, they don't know it either. You know, they were never taught in school either. So again, I think, you know, trying to find someone with the knowledge and background, you know, ask. You know, we're here to help, and the majority of the dispensaries, and you know, they want to see you succeed, and you know,
Absolutely.
that's what we're here for. So
Yeah, no, that's great.
yeah.
And yeah, that's terrific. I think we've reached a point. I'm going to let everyone know, speaking about that, you know, I'm Russell with Elevate Holistics. We are a doctor's platform, a doctor's service, virtual. You can see us right from your home. We cater to the cannabis community, so you can always feel open and comfortable speaking with us. As with Kelsey, we have a very compassionate staff of medical professionals who, on their own time, have taken, you know, their time to learn more, because this is an ever-changing industry. So we're here for you on that regard. Last thing, would you like to give a shout out for all your socials? Because, you know, in the future, we'd love to do more with you.
Yeah.
And so if you're watching, this is how you can get in touch with Kelsey.
Yeah. So again, I think it'll be in the comments or whatever, but so it's B
Absolutely.
Health Consulting, just the letter B and then Health Consulting. That's my Instagram, that's my Facebook, my website. So they're all on there. And if you know, if you're interested in me doing a talk to your organization, to your dispensary, to having classes for patients, you know, really anything, I'm willing to work with you and work with patients, because you know, my goal is for our patients to, you know, be educated to make safe and smart decisions. And so on my website, there's like a connect with me. You can shoot me, you know, fill out that form, and it'll go right to me, and we'll connect. I'd love to, you know, work and collaborate with more people. Yeah. So Be Health Consulting. We'll make sure it's in the link somewhere.
Absolutely.
So
Yeah. And for sure, we're going to put that tagged up for everyone watching. Thank you so much for tuning out. We'll add our.com. And please reach out to us for anything you need. We really appreciate everyone turning out. And the last thing I'm going to say is, for any comments that weren't covered, we will review and make sure that we reach out with answers for any questions that we may not have covered. So thank you, everyone. Have a wonderful night. Kelsey,
thank you.
see you next time.
Bye, guys. Thanks so much for coming by.
Absolutely. Good night.